We call this video series LTB, or Learning the Brainstem. The voice you hear is AI generated. We use AI to help translate videos into multiple languages. In LTB 6, we study axial sections in relationship to each other. We address tracts that pass through the high brainstem. Recall that in the photomicrographs that we use, white matter stains darkly. Grey matter structures are relatively pale. The image to the left of the slide is higher or more rostral in the brainstem than the image to the right, but both are sections of midbrain. Let's say that we identified just one white matter tract with a red circle. We take advantage of bilateral symmetry, so we indicate only one tract in the right midbrain. That way you can look to the contralateral brainstem for comparison. We circle a medial longitudinal fasciculus, which we will abbreviate as MLF. It is located just ventral to CN4 nucleus. Where is MLF in the image to the left? MLF in the image to the left is within the red rectangle, but it looks different than MLF lower in the midbrain. In a previous video, we also identified a portion of MLF at the transition of midbrain to diencephalon, and again, the morphology there is different than either cut of MLF that we see in this slide. Differences in the look of the same basic tract should not distract us. We know the significance of the MLF. It is a tract fundamental in coordinating the movements of both eyes, especially in relation to the position of the head and neck. Myelination of MLF begins even in the first month of gestation, and at time of birth it is one of the few brainstem structures whose myelination is visible in a gross pathological dissection. Moving laterally from the midline, we should notice how white matter tracts may not be perfectly discrete. The yellow dots in both sections sit in white matter in the so-called central tegmental tract. It becomes more discrete from other white matter as we pass inferiorly. It is a tract that we can visualize in various axial sections to as low as the inferior olive in the medulla. Central tegmental tract is a visible portion of brainstem reticular formation high in the midbrain. The tract receives projections from reticular formation and from periaqueductal grey, or PAG, and it contains projections that pass from red nucleus to ipsilateral inferior olive in medulla, where the tract effectively terminates. We just said that the central tegmental tract is a visible portion of the brainstem reticular formation, but to be more precise, we should say obviously visible, because we see, in fact, reticular formation throughout the area lateral to central tegmental tract, within the boxed areas in this slide. We have discussed previously how fibers of the cerebellothalamic tract encircle the medial red nucleus, as we see again in the left image of higher midbrain, as indicated by the yellow arrow. But where we might expect to visualize red nucleus once more in the right image, where the orange arrow points, we see only white matter en route to red nucleus. To understand the passage of the cerebellothalamic tract through brainstem, it will help to inspect a slightly lower level than in the right image. So, here you are. Note a couple of things. First, a red circle surrounds the MLF in right midbrain. Second, immediately ventral to the MLF on both sides, there is just darkness. The darkness contains fibers that cross the midline. Cerebellothalamic fibers cross the midline from their origin contralaterally, specifically from contralateral deep cerebellum. In LTB1, we talked about the superior cerebellar peduncles at the dorsal aspect of the high pons. The crossing that we show here is the decussation of the superior cerebellar peduncles in the center of the low midbrain. The whole image causes some confusion, since we see pons as well as midbrain in the slide, given the angle of the section. We are at the transition between midbrain and pons. When in doubt, landmarks help. The red dot sits in the aqueduct of Sylvius. Now the red dot sits in the interpeduncular nucleus, which, as we know, should be situated at the midline between cerebral peduncles. We mentioned an interpeduncular nucleus in LTB3. Back to our previous side-by-side images. To understand what important tracts pass in the lateral midbrain, it would help to reorient ourselves in vertical space. Here is the dorsal aspect of a quadrigeminal plate in a whole anatomic specimen. The quadrigeminal plate amounts to the bulk of the midbrain tectum or roof. At the level of the superior colliculae, in the upper half of the quadrigeminal plate, we can visualize an axial section such as this one. And at the level of the inferior colliculae, in the lower half of the quadrigeminal plate, we can visualize an axial section such as this one. An ascending sensory tract, the lateral lemniscus, which is part of the auditory pathway, is indicated by the pink arrow. It will enter inferior colliculus. And fibers from inferior colliculus will pass in the brachium of the inferior colliculus towards medial geniculate body of thalamus, as the pink arrow now indicates. The brachium of inferior colliculus is best visualized at the axial level of the superior colliculus. In LTB4, we briefly mentioned a brachium of superior colliculus in its relationship to pulvinar. We do not visualize it here. Nevertheless, outputs and inputs deserve more comment. The brachium of superior colliculus likely contains both afferent and efferent fibers, since projections from retina to tectum pass through it, as do projections from tectum to pulvinar. There are inputs and outputs between the superior and inferior colliculae. And the tectum as a whole may be in play, for example, when we orient our head to something that we hear and see buzzing through space. Now we can concentrate on ascending sensory tracts that are oriented differently in lateral midbrain, depending on how high you happen to be. Remember, the whole brainstem to the left is at a higher level than the whole brainstem to the right. Within the red rectangles are fibers of the medial lemniscus and the spinothalamic tract, both of which are en route to ventral thalamus. In our last few slides, we can consider why tracts matter. The green rectangles have to do with sensation. Of what hemibody? Pause. Left hemibody. For extra credit, at this high level, left face sensation is also represented. The green dots sit in the middle third of the right cerebral peduncle. The tract in question passes inferiorly. The tract relates to which hemibody? Left hemibody. The green dots sit in an ascending right auditory pathway. The main reason why I describe them is so that they are not confused with ascending sensory tracts of the body. Above the level of a nucleus, called the superior olivary nucleus in pons, auditory pathways represent hearing bilaterally. The green dots sit in a pathway that heads eventually to right thalamus. The tract relates to which hemibody? Left hemibody. The descending tract indicated by the green dots descends to where? To medulla on the same side, the right. The green dots sit on fascicles of left, CN3 in the left image, and in left oculomotor nerve or CN3 in the right image. The left eye's movements will be affected. A lesion or lesions involving these two structures result in a so-called cross deficit. Which hemibody and which eye? Right hemibody, left eye. Dopamine projections from the area marked with green dots pass towards the midline, then through the ventral tegmental area, or VTA. They collect into a medial forebrain bundle. Here's a question for extra credit. Dopamine projections from right S-N pars compacta pass to which corpus striatum? The ipsilateral one or the contralateral one? The ipsilateral one. Congratulations! Not only have you survived LTB6, but you will make your way into the pons in LTB7. As always, thanks for watching.